I'm a student with the Santa Barbara City College Radiography program, and today we're going to be demonstrating a routine knee, which consists of an AP oblique with medial rotation, and a lateral projection. So before I get my patient, I just want to set up my room here, and I want my tube detented to the table. We'll be using table bucky today. We'll be detenting like so. It's already on here. And we'll be using the 8x10 or 10x12 for the image, and I've gone with the 10x12 mirror lengthwise. And we want to make sure our bucky is aligned, our IR is aligned, so the tube will probably be changing it afterwards because we're using some tube angle today. And we have a shield here ready to go, and we're going to my patient. Ms. Garcia? Hi. Hello. My name is Erin with the radiography department. May I get your full name?
Blanca Garcia.
And your date of birth?
December 2nd, 1992.
Okay. And is there a chest pain?
No chance.
Okay. And may I ask you what brings you in today?
I actually fell like 2 weeks ago, and I've been having a lot of pain.
Okay, I'm so sorry to hear that. Yeah. Is it where's the pain more?
It's on my right knee. That's where I
On your right knee? Okay.
Yes.
Just want to make sure. And any other falls or surgery?
No.
No? Okay. So I'm just going to ask you to lay down on the table, belly up. And my patient's already changed into a gown. We want to make sure that any pants from the waist down, like jeans or so, are removed just because they're a little trickier to remove from, move up towards the knee, and we'll be needing that away. But since for the sake of the demonstration, she has her pants left on. I'm going to be shielding our patient, of course. And moving the table just a little higher. And if we want to get an SID of 40 inches here. Like so. And by the look of my patient, with the AP projection, we will be needing a 3 to 5 degree tube angle, and based on the measurement between our axis and tabletop, it looks like we'll be using a 5 degree angle towards the head. And making sure we're still aligned here. Very good. And now for the central ray for the AP projection, we want our central ray ½ inch below the apex of the patella. And we want the foot nice and straight. Now, I'm going to move your leg, okay? And knee nice and extended, and some room between both knees here. And we can be moving the back just a little bit, okay? We'll bend your knee slightly, and be looking for the patella here, apex, and move just a little bit lower. We'll be needing our right marker, and collimating point. Okay, hold on nice and still, okay, Ms. Garcia? The X-ray. We'll be changing out our IRs, reading it, and placing a new one in there. And then for the next projection, the AP oblique with medial rotation will be long rolling the leg immediately 45 degrees. We'll be moving your leg, Ms. Garcia, okay? And we want to make sure it's the whole leg, not just the foot. We're keeping our marker here, and keeping the same tube angle for this projection. And we'll be using the same central ray as well, ½ inch below the apex of the patella. And of course, collimating appropriately. That's good. Okay, hold on still, okay? The X-ray. Okay, well, I'm switching out our cassettes as always and reading this and then putting in a clean one. And for the next image, I will be doing a lateral knee. So Miss Garcia, I'm just going to ask you to turn to your right side, okay? And then based on how the patient positions themselves, you can have the unaffected leg behind them or in front of them, and the patient here has chosen to leave that leg behind them and adjusting our shield here. And for the image, we'll be needing a 5 to 7 degree tube angle towards the head. And since we already used a 5-degree angle for the last projection, we'll just keep it the same as a 5. And then we want the knee here flexed 20 to 30 degrees, as so, making sure our epicondyles are nice and perpendicular to the IR, and making sure patella is perpendicular as well. And for the central ray, for the lateral knee, we want a central ray right 1 inch below the medial condyle. So, just need to move my pigeon just a little bit. Next bit. Placing my right marker. Pollinating appropriately. Okay, just hold on still. B, X-ray. Okay, now we're going to be moving on to the next projection, which is an AP axial projection of the knee to view the endocondylar fossa, also known as the Leclerc method. And for this next image, the patient's still going to remain supine. And we're just going to ask our patient here to flex your knee 60 degrees. So I'm going to start seeing her flex your knee really quickly here. Then we're actually going to build up some support under her knee. And the IR is actually going to be crosswise for this image and also tabletop right below the knee here. Doing okay, Miss Garcia? Now for center ray, our image actually requires a center ray to be perpendicular to the axis of the long axis of the lower leg here. So keeping our SID of 40. And then center ray entering apex of the patella as well, ½ inch below the apex of the patella. Collimating appropriately. And then also marking our image. Okay, Ms. Garcia, stay still. Beep. X-ray. We'll be moving on to. And then for our last projection, we'll be doing a tangential projection of the patella, also known as the Sagass method. And for this projection, our patient's going to remain supine, and we're going to ask her to flex her knee as much as she could. So Ms. Garcia, go ahead and flex your knee all the way you can, okay? There we go. And then we're going to be using central ray based off of, tube angle based off of the flexion of the knee. And our center ray is actually going to be entering the patellofemoral joint. And I'm going to be asking my patient to hold up the IR, and I'm going to be using a portrait. Go ahead and hold this for me. Thank you. And the goal is to have the patella perpendicular to the IR. I'm just going to make sure to get them nice and even. Looks good. And marking my image. And just making sure that we're at a good distance as well. Right, good 40. Okay, hold on still. Eve, X-ray. Okay, and we're going to be reading the image. So that completes our knee